Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
glad to be here.
But a mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Maria Rodriguez-Alcala, and she is the Health and Wellness Programs Director for Heartland Forward. Dr. Rodriguez-Alcala, thank you for being here.
Thank you for having me.
So tell us what Heartland Forward does.
Sure. So Heartland Forward is a think and do tank, and we're based in Bentonville, but we cover 20 states in the Heartland region. And that's everywhere from North Dakota down to Texas, east to Alabama, north to Michigan and Ohio, and everything in between. If you look at think tanks in the U.S., if they're not state focused, all of those others are in the coast. So we were formed to be that voice for the Heartland, to fill that void, change the narrative, and show the potential that we have in these wonderful states. In our think tank, we have an economic development view. So everything that we cover in the pillars that we focus on, which is health and wellness, where I am, entrepreneurship and innovation, workforce and human capital, and then regional competitiveness, all of those have an economic development lens, basically. And again, our role is that we do research, applied research, and then we try to follow those with action items so that we're not just doing reports, but we're also trying to make a change, to make a difference with those.
And you are heavily involved in the maternal health report. Tell me about the economic case for investing in maternal health.
Yes, so that report is the most recent one that Heartland Forward has published, and I was part of the team that worked on that report. I led the qualitative research part of that report, and then my colleague Amir Farati led the quantitative side for that. So I would say that if you look at maternal health reports that have been out there in the last 2 or 3 years, we've seen a lot of reports come out. Ours had a different lens. Well, first, we did analyze all states in the U.S. for most of the things, but we took a little bit of a more in-depth view into 4 states in the Heartland, including Arkansas, Louisiana, Mississippi, and Ohio. So those are in our region. And if you look at the first 3, they're ranked pretty low in maternal health, and Ohio is doing a little bit better. So we wanted to see what's happening between these states that are ranked lower and then Ohio that's doing a little bit better. So that was one thing. And we took an economics lens, which means all of the other reports, of course, there's a lot of issues with why we should look at maternal health from a more human perspective. There's no doubt about that. We definitely need to do it. But we also wanted to show that not investing in maternal health, our economy is being compromised. And so that report shows that as well. So that's kind of like a different lens that we gave as compared to other reports.
And you partnered with AFMC for part of the study?
Yes. So as I said, this was what we call a mixed methods reports in research. And so we had a lot of data sets that were used, that were analyzed at the very local level. And then I led the qualitative research where we did about 34 interviews in the 4 states. These were interviews with providers and professionals that are working directly with high-risk moms. And so we wanted to understand how, we wanted to hear that voice also, not just look at the numbers. So AFMC helped us recruit those people across the different states.
And the project is finished, but there is some ongoing data being collected or other follow-ups?
Yeah, so we're not currently collecting any data, but we're involved in conversations to improve the data collection. So that's one thing that we're doing. And then also just recently, we met with Dr. Michael Nino from University of Arkansas. He's going to start a new survey in Arkansas that is very unique. Only the state of California has that kind of survey and will give us amazing data that we don't have right now that can help us not just with maternal health, but other health issues that we need to understand better. So with that, we're being involved in those conversations and also with the state in how, again, to improve the data collection and data sharing and things like that. And then on follow-ups, as I said, everything that we publish, we try to follow up with action. And so we are considering, of course, we're going to be doing. We're in the current moment, we're actually analyzing what is it that we're going to follow up with this report. But we're going to be involved with things related to telehealth, how to improve legislation, workforce issues with maternal health care, and many others that we have outlined in the report.
And speaking of legislation, Heartland is in this stakeholders group with the recent governor's declaration in maternal health. Tell us about your role in that group.
Yeah, so we are one of the stakeholders involved. There are lots of all kinds of different, it's everywhere from private sector, philanthropy, government agencies, local, state, all kinds that are involved in this in this group. And the idea is to bring people together. They're separated by different committees that are focusing on different topics. And so Heartland Forward is more involved in the data committee that in that group. And then in general, we are involved in some just general conversations that are related to what we had in our report. Like we put some data together for the state or whoever is asking us that if we have already that data from that report that we can use to help in those conversations.
Were you surprised by what the report found?
I was not surprised because we knew already of the outcomes from the other reports. But what I would say that I was surprised that was not in the other reports were a couple of things. So I think first, in the qualitative data, we had two people we interviewed, one in Mississippi that had a pregnant girl of 13-year-old. That was 13 years old. And then in Arkansas, another provider that had an 11-year-old. And that in a country like the US, it does surprise me to find. The other thing with the data, we saw some other reports that did comparison with other countries. So the US is behind in every indicator in maternal health when you compare it to a developed economy, but also with some emerging economies. And that was a surprise to us. For instance, Brazil, Mexico, Chile, Russia, in many indicators in maternal health are doing way much better than us on an average. So that was another surprise that we found. And then I would say also from the interviews, just even though we're in such a rough situation right now in terms of how we're doing, everybody wants to help. And so everybody is on board to just help and do something. And I think what we need right now is a little bit more of just coordination of who can do what, basically.
So what do you think that really means for Arkansas?
It means for Arkansas first that there's an opportunity for us to show that we can do not just better, but that we can also probably even become a model for others. And the fact that we're ranked so low is pushing us to really make a change. And so I think that is not all negative. But of course, for the moms that are going through the situation, this is not a good moment to be in. But I think that there is a lot of a very candid kind of interest in making a change in this, and not just us, but it's also everybody in the private sector, everybody in the government, a local, state, or whatever angle you look at it, everybody wants this to change. And so I think that's an opportunity for the state of Arkansas.
And it truly is public health, but it is also economic. So these two go hand in hand for this?
Yeah, because usually when we look at the population where we see the highest, the highest percentage of women at risk, is primarily a big chunk is in the low income population. But what we also see is that this is very similar to other health indicators we're seeing in the US that have more to do with lack of preventive care, lifestyles, how people eat, how they exercise, how they're living their daily lives. these people in low income communities sometimes have very stressful day-to-day lives. And so that affects their health in every sense. And so that's no difference for maternal health. So many of these women that are getting pregnant, they're already unhealthy before they get pregnant, right? And so that's one thing that we need to consider, is that it's not just a human thing to help the low income population, but if we're able to help, actually the economy is going to be better. So that's the primary lesson from the economics lens, is that it pays off also, not just from a human perspective or because it is the right thing to do, but also because we're going to gain as a state, or other states that do it also.
And health policy changes happening. Are you seeing that on the state and federal levels?
So I think that we've been hearing a lot of conversations in terms of health more at the federal level. A lot of it is, what do we need to do at the federal level? But what we're finding is that a lot of this needs to happen at the state level. So if you look at health legislation in each of these states, even in any of the states that we cover, every year you see a lot of health legislation being introduced, but there is no strategy, there is no continuity, there is no lens from the patient's perspective. And so that's what we need to change right now. We need to start looking at, okay, how can the states, including the state of Arkansas, start thinking about legislation that would make it easier for that patient to access care, and then also improve that access in general, right? And then there are many others like that are related to workforce, right? We need more midwives. And so how can we create opportunities for midwives in the state of Arkansas? That's another example. Or doulas that provide the emotional support. So from a legislation, there's a lot that we can do at the state level.
And tell us what the Heartland Health Caucus is. That's part of this kind of spearheading this group and Hope for Change, right?
Yeah, so this this is one of the things that ties to the action items in the report. So Heartland Forward started last year an initiative called the Heartland Health Caucus that you mentioned. So it's relatively new. This came out from another report that we did with also health, and it had to do with healthcare access, and we zoomed in a little bit more on rural communities. We found some similar things in the maternal health also with this other report. But what we saw there is that a lot of people at the local level, even those involved in economic development with health, right? They can state their issues, their challenges, their problems, but to translate that to what kind of legislation needs to happen for that to take place or to improve, very few people can do that. And so we thought that there was a need for that to happen. And then also when we think about workforce in particular, or say telehealth, which can actually help or alleviate some of that workforce shortages that we're facing in health, we saw that legislation across states is actually a barrier, because states have different legislation on how people can practice if they're providers in the border here in Northwest Arkansas, where I am, and you live in Missouri and you have your license in Missouri, you can't necessarily always practice when you cross the border, and that may just be sometimes a few miles away, right? And so one of the things we did is we helped form the Heartland Health Caucus, and those are representatives from 6 different states where we did the report. And that's Arkansas, if you go clockwise, Arkansas, Oklahoma, Kansas, Missouri, Kentucky, and Tennessee. So for each of those states, we have someone in the governor's office that's working with health policy, someone in the health department, usually the secretary, commissioner, or director, and then also the legislators that are both in the House and the Senate that are active in health legislation. So we're bringing them together to have that conversation before legislation is introduced or happens, so they can start working together internally as a state, but also across states, so that they can start thinking more as strategically, and also hopefully have the Heartland be a model for this for other states.
Well, the model sounds amazing. And would you say, is that part of the big takeaway from the report?
In terms of the model, I think, as I said again, I think that the fact that we're seeing so numbers that are not very nice, it gives us an opportunity to just jump and do the work and show people that we can change this situation. And then perhaps with those initiatives that help us change that situation, those can become models for other states that are also struggling with the same issues.
Well, thank you so much for sharing about the report and your work. And I appreciate what you're doing for the state of Arkansas and surrounding areas. It's so important for maternal health. Thank you.
Thank you so much, Robin. We appreciate it.
And that's it for this episode of AFMC TV. Thanks for watching and have a great